Hello and welcome to the next episode of Understanding Boericke Between the Lines. The prelude to this, the basic understanding of this series is given in another video, the link to which you will find in the description below. So we next start with another remedy. And as a usual practice, we always start understanding the remedy with a case. How that remedy helped us in our practice, and then the retrospective understanding of that particular remedy. This is the great master, Dr. William G. Boericke, because of whom we and all the homeopaths in the world have had accelerating results in our clinical practice. So let us start with a case. Many years ago, I was called to see a very serious patient who was in his last stage. He had a cancer of throat, and a young 36-year-old male who was having this CA throat for 3 years. The metastasis had now spread to the left eye, and when I went, his left eye was literally protruding out. Now, in this condition, the patient's main complaint was the agonizing pain that he had. And the pain was very, very severe, to the extent that he was on painkillers. Many a times he had even taken morphine, but that would hardly subside the pain. So, main chief complaint was the difficulty in swallowing. He could hardly even open his mouth, and the overwhelming pain, which did not even budge with painkillers going on 3 times a day. There was complete loss of vision because of the pressure from the tumor behind the eye. The eyeball had protruded out, and there was severe dryness of the mucous membrane. There was a past history of chronic suppurative otitis media, that is the affection in the ear in the childhood. He was a habitual tobacco chewer and even a chain smoker. The pain used to slightly subside when he was lying. But when I went in last 3 or 4 days, he was just awake with the pain, couldn't sleep even for an hour or so. In such a case, the typical homeopathic case taking was impossible, because in every few minutes he used to be screaming in pain. He hardly must have sat in front of me for not more than 10 minutes, from which I could or I have to take the totality of the symptoms. He was given injection morphine very frequently, but that did not reduce the pain. This is the diagnosis: CA, hard palate. And this helped me a lot. That's the reason I want to show you the diagnosis. In that short possible time, I had only few observations. One, the diagnosis, that is the CA of the hard palate, cancer of the hard palate. The agonizing pain that he had, he couldn't speak. Then the left eye that was protruding out due to the pressure of the tumor. He had difficulty opening the mouth. Salivation which was very profuse. And the next, that case taking was impossible. So when I put to the repertory palate, hard, cancer, the only remedy that came up was hydrastis. And this was very interesting for me. And due to the lack of symptoms, we decided to give an anti-miasmatic remedy, carcinosin 10 mg, followed by hydrastis in mother tincture, 5 to 6 drops, 2 spoons of water, mixed well, every 3 hourly. The follow-up was after just 2 to 4 days, and to my surprise, that the pain had reduced. The patient could eat well, drinking liquids was not now possible without pain, and the painkillers could be weaned off. After a few days, the pain completely reduced and was much better for nearly next 1 month. Now, this main case was to tell you how this remedy can act in terminal cases. When I was reading through this remedy, through Grimmer, he writes, this is basically an extract from Murphy, where Grimmer noted that hydrastis has been proven highly effective in liver cancers. Even in advanced cases, it has been of great assistance in relief of pain, permitting the patient to retain consciousness to the end without the need of narcotics and analgesics. So, this statement was very, very inspiring because this patient had actually gone to bare minimal pain with this remedy. Since the disease was overwhelming, that's the reason the worst of it took toll of him after a few months. But whatever little time that he stayed, he had a good quality of life. This is what Grimmer writes. This remedy has been helpful for me in many patients. And because of these many cases, we decided to understand it between the lines. So if you open Boericke, the first generalities he writes acts especially on mucous membranes, relaxing them and producing a thick yellow ropey discharge. My dear friends, you have to now broaden your horizons. When he talks about mucous membranes, it is not only the mouth and the anus, but it can be anywhere. It can be on the throat, it can be the mucous membranes of the stomach, uterus, urethra. And what is the physiological expression to it? Is a thick yellow discharge, or basically increased discharges. It is characterized by peculiar mucus discharge, and this is the hallmark of hydrastis. Then he gives the essence of the constitution. They are old, easily tired people, cachectic individuals with great debility. This especially speaks about patients with the kind of illness that they have. When you have cachexia, when you are tired, debilitated, that generally speaks of a chronic pathology in your body. He then talks about the lumbago, emaciation, prostration. And he also says that it has an action on the liver. The concluding line is cancer or cancerous state before ulceration, and when pain is the principal symptom, and that's exactly was the situation in the case. Pain was the principal symptom in this situation. And how Phatak writes, cancer of hard palate, so very clinical. And then he talks about goiter of puberty and pregnancy. Now, understanding goiter of puberty and pregnancy is a kind of understanding of the phase of life. And this is more explained detail later. But remember this, it is a situation of pathology that is associated with phase of life, and that needs to be understood. So, in the first para, he gives you the sphere of action of the remedy. He gives you the constitutional makeup of the person, and he gives you the physiological journey of the disease and its action during the phase of life. So, what is its action on the mucous membranes? It creates or secretes mucus secretions, highest mucus secretions. It is on the throat, stomach, uterus, thyroid gland, and lumbar, and there is also an action on the lumbar spine. So if you see Boericke, talks about head, and then you have sinusitis after coryza. Then the ear, you see the mucopurulent discharge, deafness with eustachian catarrh. In the nose, you see thick tenacious secretions from posterior nares. In the throat, again the hawking of tenacious mucus. So you see in each and every part of the body there is increased secretions. So increased secretions, the glariness, the tenaciousness, the yellowishness, this is the hallmark of this remedy, hydrastis. In the stomach also, you see weak digestion, bitter taste, pulsations in the epigastrium, and he writes atonic dyspepsia, ulcers, and cancers. This needs to be understood because we earlier studied a remedy for cancer of stomach with desire for lemonade and prolonged grief, especially with melancholy, that was Amon Muir. And here too you have cancer of stomach. Again on the urine section he writes gleety discharge. Then the gonorrhea with thick yellow discharge. Leukorrhea worse after menses, again the tenacious discharge. In respiratory, again the hawking tenacious expectorations. So this discharge and the secretions is a very important peculiarity of this remedy. So in every case, you need to see the action of the remedy physiologically by the increased secretions. So when you see these increased secretions, the tenaciousness, the yellowishness, then somewhere you may think of hydrastis, but it's just very initial. The deeper is yet to come. So we can now understand that there is a physiological action to a particular sensitivity of having a discharge on the head, in the head in form of sinusitis, from the ear in the form of otitis media, then nose, the tenacious secretions, similar in the throat, stomach, urinary gleety discharge, leukorrhea, and the bronchial catarrh. So this is the most initial action of hydrastis. So how do you understand hydrastis now in deeper pathologies? So this is the most important secret of Boericke. Most of the Boericke's remedies were understood by the toxicological studies. And that was never mentioned in the book, but when we understood it deeper, we could find that every remedy in which had the action on the severest of the pathology had a physiological correlation with the pathology. And that is evident in most of the cases, most of the remedies. So let us understand why it is so effective in the stages of ulcers and cancers. Hydrastis, in its original form, contains berberin and hydrastin as an active ingredient. So this action of berberin and hydrastin is actually very, very important. So what is the role of berberin in hydrastis? Berberin is an alkaloid with multiple biological activities like anti-hyperlipidemia and anti-inflammatory. It is also useful in cases of liver cirrhosis to reduce the fibrosis. Next, berberin, it is useful in patients of hepatitis to cirrhosis and cancer of the liver, which is characterized by pale, scanty stools, constipations, and hemorrhoids. Now, all those people or all those of you who are handling such kind of cases, you know that the most initial symptom in cases of cirrhosis is constipation. And in liver pathology is hemorrhoids because of the portal hypertension. So this is a kind of congestion of the liver that is set in, and in such cases berberin is one of the remedies that is having a toxicity creating this kind of pathology, and which is a part of hydrastis, hence it treats these kind of conditions. Slightest bleeding causes exhaustion. And where would this patient bleed from? This is the most important tendencies of patients who are into cirrhotic stage. So, exhaustion, which is a result of hepatitis or cirrhosis or the affection of the portal vessels, in such conditions, hydrastis also will be very, very effective remedy. If you see the earlier remedy, ammonium, it is ammonium toxicity. The ammonium toxicity causes the affections of the mind, causing confusion and delirium. So it is more of toxicity to the brain, but in berberine, it is the toxicity leading to hemorrhage, the affections of the blood vessels. Similarly, berberine inhibits certain tumor promoters and inhibits angiogenesis, making it potentially beneficial substance in cancer therapy. This is something that we found in some science journals. So, if you see, why did the patient feel better? Because in its original form, it has medicines which reduces the tumor promoters and inhibits angiogenesis. This will literally help the patient to retrograde the action of the disease. Now, this is something interesting that I tried and deciphered. The sphere of action generally is not an isolated case of ulcer or catarrh. The sphere of action has its own expression in different patients. And the expression actually depends on the miasmatic background on which the patient is born. A patient with a psoric background will have a psoric expression. A patient with a psychotic background will have a psychotic expression, and a patient with a syphilitic background will have a tertiary expression. So, in hydrastis, you see all kind of actions. You see the psoric, psychotic, syphilitic, and they are pathologically also differentiated depending on the miasmatic background. The initial stage always will be a catarrh. This is what we generally see in our practice. The sinusitis, the hawking cough, the nose blocks and the flowing nose, where you see lot of catarrh that comes in. And where would that be expressed? In the respiratory system. How do you see that? Increased secretions, cough, bronchitis, postnasal drip, the thick tenacious yellow discharge, the otitis media of the ear, and the mucus in the urine from the kidneys. So this is a stage of catarrhal inflammation that is as a result of the inflammation of the mucous membranes. This is the catarrhal stage of the remedy. Here the major pathology has not set in, but the inflammatory action has started. This is the initial stage. The next stage where you will see the bleeding piles, the menorrhagia with fibroids. This is more the psychosyphilitic stage, the psychotic more, where you have the goiters, the fibroids, the menorrhagias, and the bleeding piles also. And the last stage is the stage of ulceration, where you see the pain as the most overwhelming factor in such a condition. And the pathologies that are covered by this remedy are the cancer of the lip, cancer of the breast, ulceration of the tongues, ulceration of the stomach, ulceration of the nose, cancer of liver, and the cancer of upper palates, even the mouth cancers. So you see the spectrum which we see as a catarrh from the respiratory system to the foul discharge and the expectoration from the throat to the ulcers and the different forms of cancers. But all these expressions are secondary to the basic trait of the miasm that is present in the person. And this is very important that each one of us understand this background to see the kind of expression the patient has. Not all patients will have a psoric or a syphilitic expression, but they will always have a journey which started with catarrh to hemorrhage and then to ulcerations. How to identify now? How will you see this? How will you clinically differentiate them in their practice? And that's the reason you need to read the chapter of the generals first, because here he gives you everything, the essence of the constitution, the kind of pathology that he will have, the patient will have, and the expression of the patient in different situations. So I tried to understand in stages. The stage 1 is the stage of the catarrhal inflammation. And whenever we have catarrhal inflammation anywhere in the body, because of the profuse discharges, the first thing that comes to us is weakness, gloominess, exhaustion. This is how the first stage sets in. The patient starts getting easily tired. You have GI symptoms, but they still remain confined to sluggish digestion or constipation. Then the dull aching pains of the abdomen, the weak muscles, and the yellowish stringy discharge. This is the catarrhal or stage 1 of this remedy addressed this. The second is the hemorrhagic stage, where the weakness now gets more pronounced. There is great emaciation, torpor of bowels, and this is the pre-cancerous stage. Undefined ill health with dull, sodden look, the yellowish white color of the face, large, flabby tongue with imprints of teeth, and the intolerance to bread and vegetables, which generally cause belching. And the last stage, which we saw our case also, is the cancer pains, is the cachexia, is the weakness to the extent that he is not able to move. The cerebral effects are very, very prominent. The most important mental which Hydrastis generally says is sure of death and desires it. They know that they are going towards death and they just want it to come as early. Then the most important is the pain. When this stage sets in, generally the most important organ gets compromised and there is pain. Along with this, there is also forgetfulness. So as he writes, the general constitution can be especially old cachectic people who are easily tired, emaciated, having cancerous diathesis, and in cancer or precancerous states. The corresponding mental state for the catarrhal inflammation around the mucous membrane should be irritability in anger, especially in women after suppression of discharges. So irritability generally increases during this stage. The patient is more taciturn, disagreeable, and spiteful. So they will get irritated very fast. Because the first inflammatory stage of this patient. When the ulcerative stage sets in, then there is slight change in the mental faculty. He cannot remember whatever he is reading or talking. He becomes selectively forgetful, moaning and occasional outcries from pain, and the most important symptom, sure of death and desires it. Now, because of one very important symptom here, there is something that I would like your attention to be drawn to. Phase of life. And phase of life is an important milestone for every human being, especially women. Because there are a lot of changes that occur during different phases in their lives. Many times you will see a lot of women telling you, not well since puberty, my height did not increase, my body weight remained the same, my skin has remained the way it was in childhood. So there is a phase, that is the puberty, and some things do not change altogether. That's when you open Boericke first para, he writes, goiter of puberty and pregnancy. And this explains that there is some kind of change that occurs during the time of puberty or during the time of pregnancy. Broadly understanding, we have four main phases, especially in women. And the changes are generally due to the psychoneuroendocrine immunological axis. We are daily getting some kind of affection on the PNE axis, and once these influences become overwhelming during puberty, during pregnancy, during lactation or menopause, then this PNE axis starts to come into play, and lot of affections take place during this time. These are those important phases due to the overwhelming response of the body because of the PNEI influence. Many affections like thyroid disorders, goiters, bone degenerative changes, growth, and emotional and physiological affections. Now, these are the things that exert a change in the psychoneuroendocrine axis, leading to the change in the function of the organ. So, hydrastis is very effective for people who have thyroid disorders during pregnancy and puberty. Once you know this, then you can investigate more deeper to see if there is anything else as a possibility that needs to be treated. So, what are the entry points of hydrastis? So, entry points of hydrastis basically first will be the discharges, the thick yellow discharges. It is a very sorted out remedy for cancers, especially precancerous states of GI or cancer of breast. The tongue is flabby with imprints of teeth, dyspepsia with intolerance to bread and vegetables, and as I told you, the yellowish ropey discharges. It is also a good remedy as I spoke to you about liver affections, backaches, emaciation with broken down constitutions, lumbago, exhaustion after hemorrhoids, and cracked and sore nipples. So these are the few entry points from where you can start thinking about this remedy. Now, if we have to prescribe hydrastis, apart from the discharges, this is something that what Boericke writes, and this is what I learned in my practice to prescribe this remedy hydrastis more holistically. So who it is suited to is suited to a kind of constitution, especially the old people who have cancerous tendencies, who have emaciation and debilitation. So the patient may or may not have the disease, but there is a physiological change that is happening with these patients. They are tending towards emaciation and weakness. Similarly, the action on the mucous membrane, because it produces thick yellow ropey discharge. After the patient from affecting the patient from simple sinusitis and catarrhal inflammation of the ear, nose, throat, intestine, back, rectum, and urethra. So, these mucus secretions now are seen in each and every system. So, let it be a simple sinusitis or the affection of the rectum or the urethra. This is the most important unique feature of this remedy. But since again I have been telling you again and again, the miasmatic background really plays an important role in the type of pathology expressed in a patient. So let the pathology be any coryza to cancer. But the most important question for we as physicians will be, why did he develop what he developed? And invariably you find an answer in that. So all the symptoms of hydrastis are unique. They are unique in a combination because there is a strong PNE axis relation to the pathophysiology of this remedy. Now this PNE axis expresses its action on the physiological part of the body, that is the mucous membranes. And depending on this, you have a state of mind that develops, and that too under the miasmatic predominance of a particular miasm or a trait in the family. So the state of mind in the background of the miasmatic influence on the individuals, ranging from simple catarrhal inflammation to precancerous or ulcerative stage of cancer. And this was an important understanding that we ever had. Because of this, we could prescribe most of the remedies with ease and the results accelerated. This is just another glimpse of another remedy that I use very often in my practice, hydrastis, in all the forms, in all the potencies, but in active cases, I use the Maradincha too. If you wish to know more about this, kindly watch us on this channel or write to us on these addresses. See you soon next time with another understanding of a remedy, especially the Boericke between the lines.